And now we're on the Health Watch with a look at how technology is helping prevent heart attacks.
Yeah, for years we've known that our LDL or our bad cholesterol could help determine heart attack risk, and that is generally true. But here's a scary statistic for you. Roughly 50% of all heart attack victims actually had normal cholesterol levels, a reason doctors are always looking at new technologies when it comes to determining one's heart attack risk. Stoughton resident Ellen Budden is just 3 months removed from a heart attack.
I thought maybe I had pneumonia because I was out of breath and exhausted, and I had no clue that it was my heart.
And why would she? She had no prior symptoms or family history. In fact, her parents lived into their 80s.
Tremendously scary. I still can't believe it sometimes.
After a stent was put in, Ellen's making lifestyle changes, but her doctor wants to take a closer look.
We've been looking for new ways to understand who might have a higher risk of having a heart attack by looking at newer technology.
Dr. Jane Pearson with the Dean St. Mary's Cardiac Center says in some patients, another indicator of heart attack risk lies in the particles in our blood that carry cholesterol. You could have normal LDL levels, but if you have a high number of particles transporting them through your arteries, you may still be at risk of a heart attack. Think of it as a traffic jam. Cholesterol is the passenger in each particle on a highway. It's not the number of passengers in each car causing the traffic jam. It's the number of cars on the road.
Finding that by knowing enough to look at it can change our therapy because particle numbers are very treatable.
So for Ellen, Dr. Pearson is turning to a North Carolina company called Liposcience, who will conduct a nuclear magnetic resonance or NMR profile of her blood. It's one way to determine how many of those little particles are driving cholesterol through Ellen's arteries.
Somebody who has a lot of particles is more likely to have a heart attack. And we can treat those with adjusting medications.
There's a lot of stuff that doesn't match up, and with this this blood test, it will give her a better look into what's going on.
For now, tests like an NMR to determine your particle count are not standard in doctor's visits, but that may not be too far away.
And I do believe in time we will not be looking at cholesterol at all. I think perhaps it'll be the particle count.
And those tests might allow folks like Ellen, like her parents, to live well into her 80s.
It is a catharsis. It just, blew me away.
Now, as a point of reference, a particle count above 1,600 is considered high risk. But we want to emphasize, not everyone needs this test. If you do have a question, ask your doctor about it. Particle count, just like lifestyle choices, diabetes, high blood pressure, they're all a piece of the overall puzzle when it comes to determining your heart health.